سلام مجدد خدمت همه مهمانان عزیز که دغدغه‌شون سلامته و امروز کنار ما هستند تا ما این مسیر جدید رو با رویکرد کوچینگ یکم بررسی کنیم، آشنا بشیم و بشنویم. آقای جاناتان پاسمور از لندن همراه ما هستند. ایشون مقام آکادمیکشون پروفسور هست، مدیر مدرسه کوچینگ هنلی در لندن هستند، برنده جوایز مختلفی در روانشناسی هستند. برای ما کوچ ها جز رفرنس های اکادمیک مدغن حساب میشن. جناب آقای ایمان ابریشمچی از اسپانیا کنار ما هستند. ایشون کوچ و منتور هستند، دارای مدرک EMCC، راهبر کمیته آموزش فدراسیون جهانی کوچینگ هستند. با اعتبارنامه MCC سابقه کاری ایشون سابقه بسیار بالاییه، چه در ایران چه در کشورهای حوزه خلیج فارس و الان در اروپا. خوشحال میشیم که وارد این حوزه کوچینگ سلامت بشیم امروز، کمی بیشتر آشنا شیم از دیدگاه حرفه‌ای و یاد بگیریم. اگر در پایان یه وقت مختصری هر دو استاد به ما بذارن یکی دو تا سوال تخصصی از وبینار دیروز مطرح شده که بتونیم این یکی دو سوال رو هم مطرح کنیم، من ممنون میشم. در خدمت.
Okay. Hope you're doing great. Jonathan, I suppose we are gonna talk together, especially on this because we were something like been something like half an hour, and I suggested 1 hour altogether to do it to go deep into the world of health coaching and everything. Just first of all, I try to speak as less as possible and listen to your wisdom, especially your wisdom play an important role in the coaching world that we are having. First of all, the beautiful always map behind you. Where have you experiencing the new parts in that map?
Well, I've been very lucky to travel to lots of places across the world, probably 120 countries.
Yeah.
Well, I love having a map because of the joy and wonderful experiences I've had meeting people across the globe, from down in southern Argentina, in Ushuaia, Chile, Brazil, Mexico, Canada and the US. And then when I think about the African continent, all the way from Egypt and Tunisia, countries to Burkina Faso and Mali, down to South Africa. So lots of travel there, and across Asia I've been very lucky, and across the Pacific as well, Fiji, Australia, New Zealand, Vietnam, North Korea, Mauritania. Just a great selection of fabulous people and fabulous places, but not Iran.
Yeah.
And that's very sad that I can't come and see you in person. Recently there have been some arrests of some British travelers coming through. I send my regards to you as Iranian colleagues, and one of those people is a coach, so I'm sure that we collectively hope that issue is resolved and those people get home to their families, and that in time the Iranian people and the British people and the rest of the world can be speaking and connecting and traveling and being one group of humanity together.
Yeah, this is the virtue that we all Iranian, especially Persian history was always about, and also is always about the fact that human are all human without any borders. We all just focus on the fact that, especially in the coaching industry, it's very important to follow that. I'm right now in Spain and I'm living in Madrid, and happily everything is cool here. But over there, of course, people are living a good kind of lifestyle, but there are some problems that hope someday soon they would be solved. So, health coaching, where should we start there?
Your choice. We can talk about health. We can talk about well-being. We can talk about behavior change. What's going to be good for you?
For me, behavior change.
Okay.
Yeah.
Do you want to ask me a question, or shall I just talk?
Please go. Because actually, the thing that's the three options that you just gave me focuses on the fact that all health coaching models are basically focused on the impact of behavioral change that we can create as a coach toward people, toward healthcare system, toward doctors, nurses, nutritionists, mental health consultants, and also patients as a system. So behavioral change and system, in what ways can we connect these two together?
Well, let me start by talking about the uniqueness and specialness of coaching. Maybe would be a good place to start. And I often think that particularly professional bodies, and maybe the ICF, sees coaching as something that they own or that they invented. And I've certainly spoken to coaches over the 25, 30 years that I've been involved in coaching who say they invented coaching. I have one colleague who tells me a story about 1973, how in a dream the idea of coaching came to them. Have other colleagues who have said, oh yes, we really invented coaching. And I'm skeptical about that, because I think that coaching is nothing special in one sense. It's not special because it's who we are as human beings, what we do as human beings. So I think back to the earliest civilizations, and I'm sure this was true in Persia as much as it was in Greece. I think back to the times before those classical societies, where you can think of Socrates or Plato wandering the streets of Athens using Socratic methods, open questions, and encouraging people to think through that open question method, learning through questions. And I also think back to the time when we were hunter-gatherers as human beings. And we know that coaching is fantastic to help people to learn, and it's particularly helpful in dynamic environments. That if I want something done in a very stable environment, I can say, go to the table, pick up the apple, or go out to the farm and pick up 2 eggs from the chicken, and the person will come back with their 2 eggs. But in a dynamic environment, hunter-gatherer times, where there weren't 2 chickens in the farm, you had to go out, you're traveling valley to valley, just as we do in organizations today. The world is dynamic and changing, it's not constant. And a coaching method would have been great for helping people to learn, because what you're looking for are the criteria, not the simple facts. So I think coaching is, in essence, what it is to be human. It invites people to be innovative. It invites people to think for themselves. It uses a conversational style to help individuals to explore what's the right solution for them in that given context. So I think coaching dates back to the very time when we developed language.
Yeah.
And of course, we've now popularized this, we've professionalized this. So we do coach training, and we set up competencies and ethical codes, and we might even identify ourselves as a coach, or I'm using a coaching style. I'm sure Socrates or Persian thinkers or hunter-gatherers didn't say, I'm a coach. They would have identified themselves in a different way. But I think it's an old practice that we can find examples in Persian literature, in Greek literature, and to the very dawn of humanity. It's a gift that God has given us. I'm a Christian. I'm sure many of you have faiths too, and we share a common God. And in that sense, God has given us this ability to have conversation and to think for ourselves. And what we are doing as coaches is a very simple task, is just inviting people, giving them the space to then identify how they make progress towards the goals that they have set, maybe collaboratively with us, or maybe they've set for themselves. But when we apply that into the health context, and let me start picking up your question about individual and systemic change, I think that we often work with individuals. We're working at an individual level for behavioral change, and behavioral change comes about when individuals develop insight, when they develop the motivation, I want this, as well as I'm aware of this, and then they develop a plan of action. If I do this, this leads to these outcomes. And then maybe as a coach, or we help them to put in place accountability partners, people who support them, or the resources to enable them to progress towards that goal. So in coaching, we're enhancing motivation, we're developing insight, we're supporting our clients to develop a plan, and through that process, we're also enabling them to action that plan by drawing upon maybe new knowledge, developing new skills, having an accountability partner, and progressing over time, maintaining that motivation to achieve the goal that they have set themselves. And in health, sometimes individuals don't know what's healthy. They don't know what the right course of action to do is, or the implications of particular courses of action. And so when we look at coaching in a health context, there has been a growing body of evidence over the last 20 years that illustrates how coaching can be immensely helpful for addressing what I might describe as being health issues, but also helping people towards what I consider to be well-being. So health is, there's a detrimental aspect that I need to make some changes. Maybe, for example, I have experienced a coronary heart condition. And in that, I then had an operation, but to sustain my life over the medium to long term, I need to make changes to my diet. So I need to think about what are those changes, and I need some information. What are the healthy things to choose? What are the less healthy things that would have a detrimental effect? And then I need to start planning that behavior change. So that's a journey from unhealth towards healthiness. Other examples might be in terms of mental health, somebody with clinical depression. And a therapist can work with that individual with the appropriate training to help them on that journey towards well-being. Then we think about the overall well-being area. And here I'm thinking much more about prevention. And certainly in terms of the UK, but we're seeing this in other examples too. I've got lots of colleagues smiling and nodding on the call there. So an issue for many of you in Iran too. And here what we're doing is helping individuals in terms of preventative health. So how do we stop ourselves getting ill? Now, of course, we're human, and the very nature of being born means that we will die. However, we can maintain for as long as possible with appropriate healthy strategies, wellness, well-being, preventative strategies, we can improve the quality of life that we experience. And by this, I think about exercise regimes. I might think about dietary choices. I might think about smoking cessation. I might be thinking about our use of alcohol. All of these can improve prevention because they have detrimental effects. And individuals, if you say, well, yes, I could have another bar of chocolate. I could sit here this evening and watch television. Alternatively, I could have an apple and go to the gym. And there are choices there. And while the individual bar of chocolate and sitting watching the football on the television doesn't kill you, you don't die overnight. If you do that for 10 years or 20 years or 30 years or 40 years, it will have a detrimental effect. Whereas if you do the gym 3 or 4 times a week and eat an apple instead of a bar of chocolate, that will have positive effects for you over the long term. At least it will have less negative effects. It's maybe a better description of this, because our body, our muscle conditions, waste, etc. Other examples which we're seeing becoming increasingly popular, and I've talked about on other webinars, and I'm going to say things might be contentious, so some of you might want to close your ears. It may not be so contentious for some of you, but menopause, for example, and women's progression through the menopause, and how coaching can be a useful strategy as part of other health interventions to help women navigate that particular phase of life. Other examples too, in terms of our overall well-being, everything from fitness to mental health can have a positive effect. So that's at the individual level. But you smartly asked a second or subsidiary part to your question, which is about systemic change. And of course, we also want to change the system. And you can do that. There's a lovely story about the small boy on the beach. And the small boy goes along the beach after a storm, and there have been many starfish washed up on the beach. And the boy picks up the starfish and throws one starfish back, and an elderly man says, "Oh, what are you doing? You're wasting your time. Don't bother with that. You can't make a difference." And the small boy, you've heard the story, I'm sure, before, picks up another starfish, throws it back and says, "See, I made a difference to that one." Yeah. So we can, but individual change is useful. But actually, maybe what we need to be doing is thinking about the climate. How do we stop the climate change that's happening that creates that increased likelihood of the storm that washes the starfish onto the beach. So thinking about systemic change, and here I tend to think that coaching needs to be done at scale, and it also needs to be done so you create partly a cultural change in an organization. So just not one-offs, we're thinking about how do we coach as a coaching style leadership and managers when we're coaching nurses and healthcare professionals. So we're treating them with courtesy, we're giving them more choices about what they're doing, we're empowering them through that process. So we create a culture in the organization, we're supporting it with external coaches who are coming in. And fundamentally, we're also thinking about groups and team coaching. So we start to coach across the organization, across the system. And as we coach across the system, we don't just think about how are you going to make a change, is how are you going to lead a change? How are you going to be part of this systemic change? So we create cultures and organizations where there is respect and courtesy, and we empower people to make choices for themselves, but choices where they have an understanding of the implications of that choice. And so allowing people, motivational interviewing being one example of this, that encourages people to be aware of the consequences and the benefits of staying as they are, and the consequences and benefits of making the change. So super smart question. That's my first opener for our conversation this morning.
Fantastic, thank you. Actually, one of the most beautiful initiative that we have done up to now, especially in Persian coaching community, was the migration from external coaching to internal coaching. I mean internal, I mean inner coach, because just to echo the words that you were saying, that everyone has got an inner coach inside, and we have been trained to act vice versa. The market and everything was acting like to be the victim, or somehow the irresponsible kind of behavior that we have been trained to, actually, to be honest. But we have got the coach within us. And Jonathan, in a beautiful kind of way, I challenged something like 200 coaches to just replace the word client to myself in ICF core competencies, in order to just see what would be happening in me, in order to be, in what ways am I giving my soul space? For example, we have got this. In what ways am I am I confident in working in not knowing environments, for example? So in this kind of innovative kind of things, we create a kind of migration in all coaching industry, and we saw lots of great outputs, and we are going to do it in a kind of research kind of thing in the near future. But the thing is this, for me, especially health coaching can bring the sense of ownership or autonomy for people who for all people, for patients. And this sense of ownership, this autonomy, can reduce the amount of burden towards the healthcare system that we are something like having. And this is one of the key factors that I'm sure coaching and coaches and health coaching can play a remarkable role in it. Especially the word for me is sense of ownership. And this is very important. What do you think about it? The word autonomy and sense of ownership.
Yeah, I think in terms of choicefulness.
Yeah.
So what I'm trying to do in my own coaching practice with clients is enable people to become more choiceful. Increase the number of choices that they have, and to understand the implications of their choices. And as they do that, they develop greater self-awareness and more personal responsibility. So these aspects of coaching, and we don't talk enough about those three elements in ICF coaching. So we want people to be more self-aware, and you've alluded to that. And yeah, of course, we can coach ourselves. We can apply that lens to where am I now? What do I want to achieve? What are the implications for the choice of what options do I have available? What are the implications for those? What plan do I want to progress to achieve those goals? I think it is helpful, however, And here's my however to your question. Having someone who holds us to account, someone who asks us the blindside question, because I am not perfectly self-aware. I let myself off the hook. I tend to rate myself because I'm human, and we all do this. It's a natural tendency. We rate ourselves more highly than others would rate us. So when I drop a cup of a drink, I think, oh, the cup must have been slippery. When somebody else drops the cup of drink, I think, oh, how clumsy they are.
Yeah.
So, you know, we evaluate ourselves more positively in situations. And a coach doesn't let us off the hook. They ask us the awkward question. Whereas when we're coaching ourselves, we are a little bit gentler on ourselves. And in my coaching practice, and I'm sure it's true for colleagues on this call, a lovely thumbs up from a colleague there, was a situation where what we're trying to do is to ask our clients provocative questions that get them to think deeply. And that's the analogy, and maybe it works better in the UK where it's cold still at the moment, maybe less so. I don't know how cold it is, probably cold in parts of Iran, certainly, where you move the chair of the client closer to the fireplace. Now, we all like to sit close to the fire, but not so close that because if you sit too close, it's uncomfortable. Coaching is about developing a relationship where we feel comfortable. It's nice and warm and cozy sitting by the fire. And then we ask them a provocative question that moves their chair a little bit closer to the fire. And we see our client do a little bit of this. And when I observe that discomfort, what's my role? Well, it could be my role is to go, oh, that's okay, let's bring them back and just allow them to be comfortable again. No, our role is to move the chair closer to the fire still and to hold their feet over the fire, because my role is not to be their friend, but is to be their torturer. Now, that has particular connotation. Ooh, so I love them. I want them to do well, but I also want to hold them in a place that they wouldn't hold themselves. I want them to be challenged by what I say, not to be so challenged that their feet are burnt or that they're marked in any way, because I love them. I love the client. But at the same time, I do want them to encounter the discomfort of just being held over the fire, and it's a little bit awkward. Oh, it's a bit hot. I want to come up with an action. That's what I'm trying to achieve as a coach. I want a client to be in a place of discomfort. Now, when we coach ourselves, yes, we can develop a plan, but I'm not going to be as provocative, not as challenging as a really good external coach. And of course, when that client has developed the insight, has developed the motivation, we can move back into a more comfortable space to carry on our conversation. But being provocative, being challenging, holding that metaphor in our mind of, I'm not their friend, I'm going to be friendly, but actually I'm going to put them in a place of discomfort, a place where they have to think deeply about the choices that they have, is our role. And then the second thing that I think is different from personalized coaching is I let myself off. I commit, and every January, and it may be true for you colleagues in Tehran, that you think, hey, I'm going to go to the gym this month. I'm going to do it 3 times a week, and I'm going to go every week. And you sign up for your gym membership, or you sign up to make a change at a particular significant time. And the first week, you're really good. And you think, great, I'm sticking to my plan. And then the second week, well, it's busy, there are children, there's husbands, or there's wives, or there's work, or there's something on the television, or whatever happens. And we only go twice. By the end of the month, other things have got in the way, and we let ourselves off the hook. And I do this myself, and I'm sure other colleagues on the call can relate to this. So we're kinder and gentler on ourselves. Well, the role of the coach is to then say, how are you doing with that? Oh, well, I've been very, very busy. Yeah, you said you were busy last month. I'm hearing procrastination here. How motivated on a scale of 1 to 10 are you to make a change? What are the implications of not making a change? Why did you commit to it in the beginning? And really holding them back over the fireplace, holding their feet there to say, okay, actually, I don't want this goal. Okay, that's an insight. So what do you want? Or, yeah, I do want this goal. So why are you procrastinating? What needs to change to stop that procrastination? So we become their accountability partner. Providing another metaphor here is like being a little piece of grit. And that little piece of grit, when you put it into an oyster, it frustrates, it irritates, it annoys, and it's just rubbing away all of the time on the oyster. And what does the oyster do? The oyster forms a pearl around that little piece of grit. So holding that role that we want to be putting those little pieces of grit into the oyster, into our client, to be that irritation, that frustration that keeps rubbing, that keeps annoying. Because through that process of coaching, enables them to form the pearl that they desire.
Okay, perfect. The thing is this, I agree, but
what sort of sentence is that?
Whenever you say, everyone is less, is just focusing on the after what. No, I'm joking. I more than 100% agree. But the fact is this: in what ways? This is my question. The question of my whole life. In what ways can I be an accountable coach toward myself?
Okay, so I can only share what I do, and let's see whether you would meet your test. How about that? How does that sound as a deal?
Yeah, perfect.
Okay. So you're right. I know I coach myself, and I try and set objectives. And invariably, I tend to set objectives at the start of the new year. Yeah. And I'm very sad because we don't drink. A new year, we don't go out and party. We stay at home. And we might have a family evening together. And generally, during the course of that day of New Year's Eve, I'll put a one-page sheet of paper together with my objectives for the year. And it's just a little mind map, and I'll think about what do I want to do with family? What do I want to do on holiday? What do I want to do at work? What do I want to do with research? And I'll have 5 or 6 different categories. And then from each of those, as part of the mind map, set some objectives. Now, for many of us, then we close up our notebook and there it is, and we forget about it. Maybe we never even look at it again, or we look at it the first week, but then the pages turn and there it is. So the secret for me is that I put that up on my inside door of my wardrobe, because I go to the wardrobe every day. In fact, I go twice a day. I open the door in the morning to decide the clothes I'm going to put on, and there are my objectives for the day. So the question that I ask myself is, what do I need to do today to move closer to achieving these goals? Put my shirt on, get myself ready for the day, for a section. Here I am, like that, beautiful. And then I go out, I do my day. Not always, but sometimes I make some progress towards that. If I don't, that's okay. I'm reminded by it when I come to put the shirt or my clothing away. I open the wardrobe and there are my goals again, sitting there for me to have a look at them. And so I ask myself the question, what have I achieved today that have enabled me to move closer to those goals? Because we all have lots of noise, lots of things that are going on that distract us, that demand our attention, that are not on our priorities for the year. So we can then have a look at those and ask ourselves, what have I done, or what do I need to do differently tomorrow that will help me move closer to those goals? And then I have a mid-year review. And my mid-year review, when I'm going away on summer holidays, usually it's August for us in the UK, I'll have a look at my goals, and it's, 2/3 of the year is gone. I've still got 4 or 5 months to go. Do I need to change any of these goals? So I have a mid-year review like I would do with a client. Midpoint, how are we doing towards the goals that you have set? Let's have a little bit of review. And then at the end of the year, have a full year review. What have I achieved? What have I failed to achieve? And generally, I've made positive progress. Very rarely do I achieve everything on there. I carry those things over, if they're still relevant, and put them on next year's plan that goes on the wardrobe door. So I can coach myself, develop a plan, and hold myself accountable for that through a very simple mechanism. One piece of paper, half an hour's worth of thinking, review that mid-year, review it at the end of the year to carry goals on into next year.
Okay, fantastic. Mine is, my secret actually is something like, it has got something like two aspects. One of them is just bringing a kind of organic planning kind of lifestyle for myself. For me, organic kind of thinking is not just doing something like for 365 days in a row. For me, the quality is more important. So organically, I myself coach myself in order to just have those plans. But a kind of, how to say, a kind of stupid kind of thing. Forgive me for this word, but I have a kind of team coaching session, Jonathan, with myself. You know, I have a team, you know, in me. Actually, I have got something like, right now I have got 8 different kind of projects in me. For example, the projects that are related to my work, projects that are related to just me, Iman, and projects that are related to my relationships. And I have got these kinds of projects as individuals. And each week I have a team coaching session with myself, actually, to be honest. It might be a bit, you know, just find your words. But the thing is this, whenever these are my stakeholders, and I am one of the key stakeholders, and whenever I'm down there, I can actually coach these projects of mine with powerful questions. Oh, I'm sure, of course, it's hard for us to challenge ourselves. It's, you know, of course, we lay ourselves off. Of course, we don't put ourselves into some corners, of course. But it's helpful. For me, it was helpful this moment. The question is this, because I don't want to, you know, get off the road of health coaching. The question is this. If you, as a person who have been working in this area, if you wanted to suggest a system to draw the culture, or to foster actually the culture of coaching in their healthcare system, what was your ABC kind of things to suggest?
Well, if we're thinking about health systems, I think we need to think at 2 levels. We need to think of health systems as being a group of employees, healthcare professionals, medics, nurses, physiotherapists, psychologists who are working in the organization as employees. So how do we put in place coaching systems to support and enable those individuals? And I would always start with, I think about addressing that at multiple levels.
Yeah.
So for me, that's about changing the organization's training and development, so everybody sees coaching as being a way of engaging. Mm-hmm. And predominantly, if you're on a management training program, coaching is a skill that is covered as part of that management training, just like it is giving feedback to people. And feedback has a place, certainly coaching has a place. So what you're training is that every supervisor, every manager, every team leader, everybody with an authority perspective would have the ability, because they've been trained, to be able to use a coaching style, a coaching mindset, which is about curiosity, about openness, about facilitating that conversation with the individual to discover themselves, personal responsibility, and becoming more choiceful. So that's step 1. Step number 2 is about a formal group of internal coaches. Build an internal coaching pool, training people in coaching skills, and that could be 3 or 4 days of coach training. It could be getting a formal coaching qualification. But those people are then deployed internally to provide coaching on demand for people at key points in their careers, transitions. When I moved from being a junior doctor to being a senior doctor, when I moved from being my first year as a sort of a nursing assistant to being a nurse, whatever the grades are, as people make a significant step up, having coaching to support that career transition. And maybe other key life points when people are returning to work after having children. Maybe other points in their life where work has been particularly stressful. We've had 2 people down in our team. Actually, I need some coaching to help me prioritize and to develop the resilience to manage this period of time while we've got 2 colleagues off who are maybe having children, or maybe they're off sick, or maybe we can't recruit to those particular roles. So coaching for on demand across the business for these internal coaches. And then lastly, using external coaches to come in, maybe colleagues who are on this call, like Hami, who can come in and do some coaching and support senior leaders in the organization through the leadership challenges that they have. So in that process, then It might be 3 coaches, it might be 336 coaches that are coming in, supporting the organization on demand, but particularly at transition points. So maybe a new chief executive or a new leader of the organization comes in and commits the organization to a big change program. Maybe the organization is implementing AI technologies to help with diagnosis. How do we do that to integrate these AI technologies to support the skills of our human staff to optimize the value that AI creates while not losing the skill that our human staff have in this diagnosis pathway? So big transitions can be a very useful time for these external coaches to be coming in. And through an integration, you're beginning to create for employees the coaching skills that enable a coaching culture to emerge. You talked about that earlier. So that's level 1.
Yeah.
The other level, parallel to it, I guess, is patients, people who are using those services. And now if you're undergoing a heart operation, you're unconscious. I've just had a spinal operation. Apart from saying hello to the surgeon and to the anaesthetist as I went into the theatre, and then they gave me, they said, oh, it'll just be a small prick and short injection. I was out in 30 seconds for then 2.5 hours. I didn't need coaching, but after the operation, I'm now working with a physiotherapist who's helping me to restore my overall well-being because of this spinal operation that I had. So I've got exercises I'm supposed to do. Coaching wouldn't be very helpful for the surgeon because I'm out of it. I'm unconscious. Yes, as a staff member, the surgeon speaking to the anaesthetist, the surgeon speaking to the nurses, a coaching style could be helpful, maybe in some parts of those conversations. Yeah. And there are certain things, Atul Gawande's work, for example, on checklist manifesto. You know, we know there's simple things that actually the surgeon should do. Has everybody washed their hands? Be surprised that he was surprised from his work, found that about 30% of the time people hadn't done that just before we start the procedure. You know, have we are able to count all of the instruments? Has everybody introduced themselves and identified what their role is? So key things in the surgery process, but coaching can play a small part there. But for me on my journey of recovery with my physiotherapist, coaching can be a great process. What do you want to achieve? Good question. How much time have you got to commit to this? In what ways can I best support you? So I love the physio, and it may be true for nursing staff. It may be true for other staff too, to ask the client, the patient, the user of the service, what do they want to achieve? How do they see themselves getting there? What role can the health professional play in supporting them? And we know, I talked a little bit earlier about weight loss, about medication adherence is another example where there's reasonable research that coaching supports that sustained behavioral change that's required for the journey, recovery journey towards well-being. So I think it's at 2 levels. I think the coaching culture is part of it, but patients would be the other part of that process to optimize the benefits for patients and for employees in health organizations.
Perfect. Thank you. Just to be more precise, how much time have we got, Bahar? Yeah.
We have about 20 minutes left.
20 minutes. Okay.
We've got lots of questions, Iman. I can't.
Yeah. That's why I
always love to answer questions from colleagues.
Please.
Thank you so much. Thank you so much. I have some small question, and we need some kind of clarification about some words. Yesterday we had some introduction to health coaching. We said something. There are some questions. I've been a kind nurse for 10 years, 15 years. Is it coaching? I'm kind with the patient in the hospital. Can it be coaching?
No.
No.
Great. Why? What's the difference?
Well, I can be kind, and coaching as a conversational style rather than a gesture towards someone. So yes, we need to build a relationship with that individual, but actually we need to do more than that. So kindness is just about a supporting style, and you could be kind and you can tell people what to do with kindness. Get out of bed, You say it nicely. Oh, get out of bed.
So
but that's not coaching. You say, when are you going to feel ready to make a move to get out of bed? Might be a more coaching style approach. So we want to be using a conversational style. We want to be encouraging the individual to develop self-awareness. We want them to become more choiceful. Kind is a completely different thing in my book.
So great. Thank you. There's another question. I've been a doctor and as a physician for working more than 20 years. I had lots of empathy and sympathy with my patients in my office. Is it coaching?
No.
Great. What's the difference?
Well, we might need to be empathetic towards our client. So yes, we need to. So empathy, Carl Rogers describes empathy as being imagining ourselves in somebody else's shoes. So imagining ourselves in their particular situation. But again, that isn't facilitating behavioral change. That's about, we use empathy, or we are empathetic, which helps us to build a relationship with our client. But as I suggested, we're not just their friend, we're not a family member. We also want to be provocative. We want to challenge them. We want to hold them to account. We want to hold their feet over the fire. And so in this sense, this is very different from just being empathetic, just being kind. So these are important qualities. I wouldn't criticize in any way a nurse who is kind or who is empathetic. Those are essential skills, I would argue, for nursing. They need to be kind. They need to show empathy. But when they're using coaching, they need to do other things as well.
So great. Thank you so much. These are the questions which are mentioned, and I'm mentioning them here. So if you have annoying questions, if you have questions which are not kind, how can it be helpful for a patient who's in a serious situation in a medical way? For example, there is a surgery. You as a coach have some questions which are not completely kind. Sometimes they're annoying. So how can it help my patient in a hospital before an important surgery? Isn't it dangerous for him or her?
I wouldn't say it's necessarily dangerous, but I don't think maybe the moment before surgery or the day before surgery or while I'm lying on the surgeon's table, that isn't the time for a coaching conversation. The surgeon is the expert. I'm going to be unconscious. Asking me, how would you like the operation to take place? You know, there's a technical procedure to be followed. I don't know what that technical procedure is. The surgeon has trained for 2 decades to be able to carry out spinal surgery on me. But after the operation, the nursing staff says, when will you feel ready to get out of bed? And if I'm quite happy lying here. Maybe then the nurse might say, well, what we find is that people who get up more quickly after the operation make more progress in recovery. So providing me with a piece of information. Now they're going to ask a second question of, have a think about that. And when I come back after lunch, let's have a talk about your plan for getting out of bed this afternoon. So placing the responsibility, we're not telling me to get out of bed, but they've given me some vital information, which is what they did, and then say, when are you going to get out of bed before lunch? No, okay, right. We'll have lunch. We'll bring that in, and then we want to talk about when you're going to get out this afternoon. You're going to get out at 1 o'clock, or are you going to get out at 4 o'clock? And that sort of is an appropriate intervention. And coaching really comes in with my physiotherapist, who's then saying, how are you getting on with your exercise routine that I've set for you? And what was going to be your next step? How are you making progress towards your goals? So coaching can be immensely powerful there. And I find my physiotherapist, who's helping me in that recovery journey, is using many of that style, along with information. He's sharing the exercises that I should do for the muscle groups that I need to work. He doesn't say, okay, Jonathan, well, what do you think you should be doing? I don't know, you're the expert. So, of course, I'm going to listen to the advice and then think about how I want to apply that advice to my situation. What am I finding easy? Okay. But also, his role is to challenge me and encourage me to keep going. Because if it's down to me, I'm going to sit on the sofa. eat a bar of chocolate and watch football. So he needs to encourage me. He needs to push me forward. And that's his role as a coach. So yes, kind, yes, empathetic, but also appropriate interventions when I have a situation where I've got enough knowledge to be choiceful.
Just to add something, into in this, especially because I know where is this coming from, because from the other industries that they always ask, okay, coaching, okay, of course, if you are gonna just ask some powerful questions, in what ways are you gonna, for example, do this kind of thing when someone is in pain or something like this? The thing is this, because mostly people think that coaching is just going with tough questions in order to create awareness or something, in order to create magic or something in that person. No, it's not. For me, it's more to do with the context, that I am there with the client, with the patient, with whoever it is down there. So if we embrace the context and see it as a system, I can see that, okay, is it a good time in order to ask these kinds of questions? Is it normal? Is it cool? Is it efficient to bring these kinds of questions onto the table, or what? So this is very important, the context. We coaches focus and understand and realize the whole context, and then bring up the questions onto the table.
Thank you. There's another question. Everything related to health is related to science. It's science-based. How can a coach with 8 competencies can be near to the patient and have a better situation for her without any physiological science?
That's a great question. And the simple answer is the coach doesn't need to have the physiological knowledge, because they're not giving advice. Now, in a medical context, if they're already a professional, let's say they are the physiotherapist can combine a coaching style with the information that they will share with me as a patient. Here's the information. Now, what are you going to do with it? Is the coaching style, the application of that knowledge. So it can be combined, but equally one can coach somebody, and many of us are coaching in organizations, and we might be coaching somebody who's the chief finance officer in a global organization. I'm not an accountant. I am not a chief financial officer, but I can still ask that question about leadership, about challenges, about prioritization, because it's the individual coming to choices themselves, using the knowledge they have of themselves, the team that they're working with, and the system in which they're working to come to their own solution. So coaching isn't about having detailed knowledge, telling the person what to do. It's about inviting them with the knowledge, some of which you might provide, or that they might already have, to make the choices that are appropriate to them within the system that they find themselves.
So great. And Ms. Sakin Albert yesterday said, we coach the person, not the illness. This is the big difference. And this is completely new view through the development of person or patient. And another question. When you talk about creation and awareness in coaching, in a health context, how does it happen when you don't have any physiological science, when you don't interrupt in physiology? How does awareness and creation happen, for example, between a physician and a patient, between a nurse and a patient? What is creation? What does it mean? Is it against science? How does a patient who doesn't know anything about physiology can create something for himself or herself?
So I think the patient does need to have some knowledge. So the example I gave you earlier from my own personal experience, just before Christmas, I had this spinal operation, and the nurse said, I was wheeled back, I woke up in the bed after the surgery, 2.5 hours of surgery, I woke up in the bed, and the nurse provided me with information, which said, do you want to get out of bed? I said, really? Very good. and the information was then provided. What we find is patients who get out of bed sooner make faster recovery. There's the health intervention. Here's the knowledge, evidence-based. This is what we find. This is what research tells us. Then it comes back to the question, she could have said, now get out of bed now. I'm going to make sure you walk down the corridor. Highly directive approach. What would I feel? I'll feel resentful. I might refuse. She could have dragged me out by my hair, but it's not probably the appropriate way for the nurse to conduct herself. But more powerful is to then say, well, given this information, that it's better to get out of bed, when are you going to get out of bed today? So in other words, encouraging me to focus on setting a goal for myself when I'm going to step out. Yeah, I'll do it after lunch. I'll do it after lunch. Great. Okay. Now she's got a commitment, and then she'll hold me to account after lunch. She'll come back and then say, well, have you had your lunch? How was lunch? Very good. Okay. You said before lunch you were going to get out. Let's give that a go now. Are you ready? Yes, because I'd already made that commitment. She's holding me to account, can make that step. So it isn't about actions without evidence. It is personal choices taken place with the knowledge that the physician or the medical expert has provided, or that I might already have that knowledge. So let's talk about, I'm a psychologist. So I might have knowledge about mental health, and based on that knowledge of mental health, I could be making choices about the best way, because I'm training cognitive behavioral therapy. I can understand how deploying cognitive behavioral therapy or cognitive behavioral therapeutic techniques, I can deploy them in a coaching context because I've already got that knowledge. So I think it's about coming together, either the knowledge the person has or provided, with a coaching style to make that person, using their own motivation, their own awareness of themselves, to make a decision what's right for them.
Great. For more than 200, 300, 500 years, people had physicians, nurses, and they are cured. Nowadays, in the hospital, we have therapists, we have psychologists. What is needed to have a coach in our team? The coaches, which are supported just with 8 competencies.
So I would say that the health professionals should be training themselves in coaching skills. It's just a conversation. It's nothing fancy. And what we're doing is we're encouraging the patient to be aware of the knowledge, so the knowledge provided by the health professional, and then how do you implement it is using a coaching style. So it doesn't mean you put a coach into every health team, into every ward, into every hospital. That can be helpful, but it's even more helpful when every health professional trains to be able to use a coaching style alongside providing information.
Thank you so much. And what's the difference between coaching and the people who come here and said, okay, you can do everything that you want, just dream it and you can give it, you can have it. What's the difference between something with some people that come and say, okay, you can do everything that you want? Is it coaching?
So we are empowering people. And when it comes to a health context, of course, people can do whatever they want. Of course, they can do whatever they want, because in reality, the physician can't control them. And it's true with governments, and it can be true with any situation. Mr. Trump, whoever it might be, he might make demands on people, but just because you demand something or instruct someone doesn't mean to say that it will always make them do that. Because we as human beings, in the front of my physiotherapist, I say, oh yeah, of course I do the exercises. But he's not in my living room every evening. And even if he is in my living room for the evening, he's only there for 20 minutes and then he's off to the next patient. And then I choose what I do if I sit on the sofa and eat a bar of chocolate and not do my exercises. So it needs to be the motivation come from the individual. And when that's intrinsic motivation, I'm more likely to change. So developing the intrinsic motivation is what we should be doing as coaches, not extrinsic, not telling people what to do, because you can threaten people, but people find a way of cheating. People find a way around those things. Yes, maybe not in front of the physiotherapist, but as humans, we find a way to cheat. So much better that it comes from the person, their beliefs, their motivation, than it's imposed from outside, because it never works to impose things from outside. Temporarily, yes. In front of other people, yes. But we as humans always find our way around the situation. So much better that my physiotherapist gets me to be motivated for those goals, that they're my goals and my aspiration. And yeah.
Thank you.
Other
Thank
questions?
you. Yes. Do you guarantee the curing process of a person by coaching?
No, because it's not my responsibility to get them to change. It's their responsibility.
So why do you come and add your abilities to a health team in a hospital if you don't guarantee anything? I guarantee the curing with the medicine. The therapist guarantee the process with the knowledge of the science. What do you guarantee?
I'm going to challenge you here, if I may. I don't think clinicians do guarantee anything. My surgeon said, it's a good chance that you will have a reduced level of pain, but I can't guarantee that it will be zero. In fact, there are risks associated with this operation, and you may never walk again. There may be something that I haven't foreseen that could happen during the operation. It's a general anesthetic. There's a 1 in 10,000 chance that you'll die under a general anesthetic, given your age. Okay, so no guarantees with anything that medicine does. What medicine does, it uses an evidence-based approach to increase the chances of a successful treatment, and coaching does exactly the same. We use an evidence-based approach. The competencies are just a guide. They are not a recipe. They are just some basic steps to guide us in the process. And alongside those, there are evidence-based approaches according to behavioral coaching, positive psychology coaching, solution-focused coaching, where there are similar evidence-based evidence to support those types of conversational approaches that enable behavioral change. But just like a surgeon, just like anybody, my physiotherapy, if it's I don't do the exercises, I'm not going to get better. If I don't implement the plan that I commit to in coaching, the change won't happen. It's all down to me. I'm being empowered to do this change. So this comes from my intrinsic motivation back to this. And I think that this is the best way that it can be. Telling people to do things. We look back over history time and time again. Societies that do that fail. What you want to is to unleash the potential that exists in every single human being to do what they want to do. Yes, maybe we need to provide rules and boundaries for individuals. And with knowledge, we can say this is the reason why I'm doing it, then it comes from my motivation. And coaching is an evidence-based approach. There is evidence around this. If you Google some of my research on my website, jonathanpassmore.com, there are loads and loads of research papers to go and have a look at. If you want other evidence, I'm very happy for people to reach out to me on LinkedIn. I'll put up my QR code in a minute and people can connect to me. But it's an evidence-based approach, like other health approaches are evidence-based. So it's no different. But it does require the individual to make a commitment because it's all about them and what they want to do. And I always say as a coach, when the person succeeds and makes the change, it's not my success, it's theirs. But equally, when the person doesn't implement the changes they've committed to and fails, it's not my failure as a coach, it's theirs. So their success and their failure, when it becomes, it's all about me as the coach,
yeah,
I'm taking the power away from them. So it's got to be them. They've got to want to do it.
Thank you. Thank you. I have just 2 other questions. Number 9, maybe. What is the danger of coaching? Is there any danger in coaching process? Is there any important period of time or process in coaching which is danger to the people?
I guess I would say there are lots of potential side effects from coaching. There's an interesting paper by Carsten Schumeli from a couple of years ago in the Journal of Managerial Psychology, and he talks about these side effects. So one side effect is the person wasn't very motivated because maybe their manager sent them to come to coaching, and they weren't very motivated. I've certainly had people who sit there and go, "Come on then, Jonathan, I don't really want to talk about this, actually. What's the point?" And that's okay. Let's talk about the football then. I don't know. I don't mind. I'm being paid. It's all right then. But what you find is the people talk about the football, then they talk about their horrible boss, or they talk about their horrible job, or they talk about the stress, and then gradually you've built a relationship and the person starts to engage. So there is a side effect that people turn up, but they don't make a change. There's a risk that people identify themselves, the actions that they want to take, but they don't carry them out, or those actions that they commit to are not very successful, or they have detrimental consequences. Well, it's their choices, and all we do as the coach is hold up the mirror and invite that person to think about the benefits and consequences of the choices they have. I think we need to protect individuals. So if someone said, "I'm really unhappy at work, I'm going to kill myself," then I have an ethical responsibility to protect them. But with that aside, if they said, I'm being paid a large amount of money in my job as the director, but I'm not very happy in it, so I'm going to resign next week, I wouldn't say, "Oh, great, let's plan how you do that." I would say, what are the consequences of that? How might that impact on your family? What might be the consequences in terms of your career, your housing costs, looking after your children? So we encourage people to think about the benefits as well as the consequences of any decision. But as long as people are aware of the consequences as well as the benefits, it's their choice what they do. As long as I think they're not harming themselves and they're harming somebody else. You know, it could mean that they drop from having a large salary to a small salary, but maybe they increase their overall happiness. That's what's more important to them. That's their choice. That's good. So I think in relation to side effects, they're relatively minimal because we're not doing an invasive intervention and we're not telling people what to do. So in that sense, the side effects on coaching are very few and far between.
And
Thank you.
And also ethical consideration, Jonathan. That is one of the most, key factors.
Yeah, absolutely.
Especially ethical consideration. But I can tell, these kinds of actually questions has got a terminology that where is it coming from, and it's coming from the fact that if we just take a look at the whole healthcare system as a puzzle, the coaching industry, which piece of puzzle the coaching industry is gonna pick. Sometimes it's not. Sometimes it's ambiguous for coaches. Okay, what is the specific action that you are gonna take toward healthcare system? Okay, are you gonna help, for example, a physician or a doctor to improve the goal setting of the patient? Are you gonna help them to have their coaching style or so? Or what is specific action that you are gonna, what is that piece of puzzle that you are gonna take? Otherwise, especially we are gonna be, faced with many kinds of, criticism. Okay, you are not something, just 8 core competencies. No, it's not just 8 core competencies. It's the whole idea. It's the whole scientific idea that is behind those 8 kind of core competencies. This is very important to just focus on more. Message.
Thank you. And the last question: if we ignore and omit coaching in a health context, what will be less?
So I think that we could have an analogy that coaching acts as a supercharger. It enables and supports patients to make more rapid progress and achieve better outcomes. So it's the equivalent of if you have a bicycle and you put a battery on your bicycle, and it enables you to make more progress with less effort. And This is true in all organizations. Yes, people might find their way, but with a coaching style, they're more likely to be more motivated, more likely to make more rapid progress. And we can improve, when we talk about health and well-being, the health and well-being outcomes of our world. And that's got to be a good thing.
Thank you so much. Thank you, Jonathan. Thank you, Iman. It was an honor of me to be in this dialogue. Yes.
It was lovely. I've got 3 things, if I might say 3 things, if that's okay.
Great.
Number one was I'm going to share with colleagues, because I prepared a slide presentation for you, because I thought you wanted me to do a presentation. So I'm going to put this up on the screen. So here's a QR code. If you have a smartphone, you can connect to me on LinkedIn. You just click on that code and it'll take you to the page. And if you don't have a smartphone, that's okay. Then you can just type in my name. If people are on LinkedIn, it's always good to connect to people. That was number one. Number 2 is on my personal webpage, jonathanpassmore.com. There's lots of research if people want to follow that up. And specifically, this may be the reason why you asked me to come along. I'm just going to stop sharing. I'm going to share this with you instead. I have a new book out, which is here, so people can access that if they wish to do so. I don't know whether you can order books in Iran in English and get them posted in. I know some of you are not in Iran. You might be in Belgium, Hami, or in Spain. Nice to see you there. So you might be in other parts of the world, in which case you can easily get these books. And then the third thing I was going to say is I love to collaborate in terms of research. So I'm always keen to connect to people if there are research opportunities in health organizations in Iran. It would be great to collaborate with someone to do a study to answer some of those questions. Does it help? Well, let's do some research that we could publish. I saw a colleague a moment ago flash up on the screen. She's disappeared now, but I've been working with some other people in Iran to support their research, and who are collaborating me with research projects in the UK. So it's always good to have an international network working together to build knowledge, to improve health and well-being outcomes, and to build the overall research on coaching. So if there are colleagues out there who are interested, it's always nice to connect with you on that. So from my side, it's been fabulous connecting with you. Hopefully it's been good from your side to connect.
Yes, great.
Thanks so much for your enthusiasm. I love the person who's called Coaching Network, who's been thumbs upping me all the way through, and yeah, lots of waves and stuff. Thank you very much indeed. Final thing I was going to say is, if people are happy, and I appreciate the cultural context, which is why I'm asking your permission, if you put your cameras on, we could take a photo, and you as a network could post on LinkedIn, or I could post it on LinkedIn, whichever way. So we've got 72 people who haven't got their cameras on, and we could go to a screen where we might have more people on the screen. So if you want to switch your camera on, you can be on the page. If you don't, I fully respect that, which is why I said this.
Your sciences is translating. The people have maybe some minutes later, and they will open their cameras. Yes, and we can share your slides in Iran Coaching Network site too, and we can share the QR code and the name of the book and the name of your website there. We want some time. Hami, do you want to ask your question, and then we go through the photo taking?
Yes, please. Thank you.
Hello,
Just
Hami.
most, yeah, hello, Jonathan. Here again. Yeah, I'm here. Okay, just following Iman's question, and such a question comes from yesterday webinars. I want to raise up a critic question here, just hearing from you for Persian community about the competence, and not just a competency that we're talking about just as a coach, but a competence about the health coach. That how do you see it, Jonathan, in a short, that a person who wants a health coach, whether a coach who wants to work as a health coach in health context, whether a health promoter wants to be a coach in, for example, health context. So we have two community meet each other, and they want to work each other or be one figure. How do you see this in a competency of a person with this title?
Wow. Okay. So maybe a way of saying this is there are lots of opportunities for people to do health coaching, and I think that we can use basic skills to do that as a coach, but it's even more powerful when it's undertaken by a health professional. So I don't think there is specific training that people need to do, but it's helpful if they can have that. And I'm going to put on the screen in a moment a conference that people might find of interest. If I can get my technology to work to come and do that, it doesn't want to do it. Maybe we'll try this. Is that going to work? Don't know why. There we go. If I put this into chat, this might be something that colleagues might be interested in. So this is a conference happening. It's a global conference on health and well-being on the 1st and 2nd of May. People might be interested who are in the health or well-being sector to come to this, or if you're interested in the health and well-being coaching, this might be something to follow up, and you can register on that platform.
Yeah. Okay.
Thank you.
Are we ready for a photo?
Professional answers and sight of view through coaching. Thank you so much. دوستان دوربین باز میکنید. آقای پروفسور میخوان یه عکس دست جمعی بگیرن و در لینکدین به انتشار بذارن. I'm inviting people to open their camera. Sometimes in Iran we have net problems.
Yes, you're not the only place in the world. Sometimes I have net problems too.
Thank you so much.
And we'll see whether people open their cameras or it's just going to be the 6 of us.
Yeah, I'm already taken. The picture is already taken.
There are cultural issues I appreciate that may impact on people, whether they want to appear on a camera or not. And I'm fully respectful of that.
Thank you. Thank you.
But I'm sure there are lots of men who are very happy to appear on camera, like Iman, you know, good looking. There he is.
Yeah.
Like
Thank
cool
you
dude.
for the compliment, actually.
Sorry?
Thank you for the compliment. Yeah.
Oh, now there we go. A few more people. Okay, so are we ready? Or do you want to move a moment or two? All right, let me have a go, then I'll say smile. Oh, that's no good, is it?
We already took the picture.
Oh, you've taken a picture. Let me take one then. Big smiles for you. Smile. There we go. And we will pop something on LinkedIn. If you do the same, and you tag me, I'll jump in and promote your network. It's been lovely connecting with you. Thank you very much indeed. It's been a delight.
Great. It was much more than a webinar class. Thank you. Thank you so much.
Thank you very much.
Thank you. خیلی متشکرم آقای ابریشمچی، سپاسگزارم. مرسی که به ما موقعیت دادیم که یاد بگیریم. این دیدگاه کوچ درون یه دیدگاهیه که ما به ابزار جدیدی در دنیای جدید انگار مجهز میشیم. ممنونم که فرصت یادگیری برای ما ساختیم.
ممنونم، مرسی از شما. امیدوارم که حال دلتون خیلی خوب، خیلی متعادل و اینکه امیدوارم که بتونیم یه مرزهای خوشرنگی رو برای فضای کوچینگ سلامت در دنیای سلامت ایجاد بکنیم که اون مرزها بتونه بارهایی که از روی دوشهای توانمند و شاید بعضی وقتها خسته نظام سلامت ما هست بتونه کمک بکنه و برداره و بتونه این مسیر رو تبدیل به یک سینرژی قشنگ بکنه و کارهای بزرگ و جذاب. حال دلتون خوب، جاری باشید. مرسی از دعوتتون. به امید دیدار. خوب و خوش باشید.
متشکرم. مرسی برنامه آموزشیتون رو جا باز کردین. متشکرم. تایمشون بود. خدا قوت. ممنون که کنار ما هستین. امیدوارم که انرژی گرفته باشین از این بحث که سوالا رو مجبور شدم شفاف و to the point بپرسم. وقت نداشتیم و نیاز داشتیم که این نگاه حرفه‌ای رو ببینیم.